Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Embolization of aneurysms. Introduction. An aneurysm is an abnormal bulging of an artery wall. Aneurysms in the brain can rupture and bleed. Bleeding aneurysms can be fatal if not treated. Your doctor may ask you to have an aneurysm embolization. The decision to have this procedure is also yours. This patient education tutorial explains the benefits and risks of aneurysm embolization. It reviews the symptoms and complications of brain aneurysms and discusses diagnostic tests and alternative treatments. The tutorial also describes the procedure, its risks, and required follow-up visits. Brain and strokes. Like all body parts, the brain is composed of living cells that require a blood supply to provide oxygen and nutrients. Blockage or rupture of blood vessels supplying parts of the brain cause most strokes. When a blood vessel becomes blocked, the part of the brain that receives its blood supply from that vessel does not receive enough oxygen-containing blood. If the blockage lasts long enough, brain cells die and a stroke results. A stroke can cause different symptoms depending on which part of the brain is hurt. Some regions of the brain can die, and yet the patient will have no symptoms at all. Other areas of the brain are more important. Even a tiny stroke in these locations can cause severe disabilities. These include difficulty with speech, blindness, paralysis of an arm or leg, or even death. Aneurysm. An aneurysm is an abnormal bulging outward of an artery's wall. The wall may smoothly bulge outward in all directions, or it may form a sac coming from one wall. If the aneurysm ruptures, blood flows into brain tissue or around the brain in a space called subarachnoid space. A patient with a subarachnoid hemorrhage usually suffers the worst headache of his or her life. This is sometimes followed by nausea and vomiting. Double vision, neck stiffness, and a loss of consciousness are also common. Subarachnoid hemorrhage caused by an aneurysm is a medical emergency. 10 to 15% of these patients will die before reaching the hospital. Over half of the remainder patients will die within the first 30 days after the hemorrhage. Of the survivors, approximately half will suffer a permanent stroke and may need extensive care either at home or in a nursing home setting. Strokes caused by subarachnoid hemorrhage can occur immediately after the bleeding, especially if the bleed directly destroys brain tissue. Another type of stroke often occurs 1 to 2 weeks after the hemorrhage itself. This type of stroke happens because the blood from the hemorrhage irritates the blood vessels of the brain. This causes them to narrow or go into vasospasm. When that happens, blood flow decreases in the affected artery, and the brain supplied from that artery cannot get enough oxygen and nutrients and may die off, causing a stroke. Vessels in vasospasm may not supply the brain with enough blood. Treatment of patients with ruptured aneurysms usually consists of blocking off the aneurysm so it will not bleed again and trying to prevent or minimize the effects of vasospasm. Less commonly, aneurysms cause problems not related to bleeding. An aneurysm can form a blood clot within it. This blood clot can break away and be carried downstream until it obstructs a small arterial branch, causing either a stroke or a mini-stroke. An aneurysm can also press against nerves, resulting in paralysis or abnormal sensation of an eye or the face. It can also press against brain tissues, resulting in seizures. Aneurysms usually result because of some weakness in the wall of the arteries, allowing them to bulge out. The majority of aneurysms are not due to any disease. Some aneurysms are caused or made worse by high blood pressure and smoking. In some cases, aneurysms can be associated with other abnormalities in the body, such as kidney problems. Aneurysms can be seen in more than one family member as well. This is rare.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms and diagnosis. Aneurysms may not cause any symptoms until they rupture or begin to grow. A growing aneurysm may cause problems such as headaches, double vision, loss of vision, and numbness in the face. If an aneurysm ruptures, patients may exhibit signs of nausea and vomiting, stiff neck, visual changes, and headaches. These headaches are frequently described as the worst headache of my life and are accompanied by an extreme sensitivity to light. Many aneurysms are nowadays found by accident when the patient undergoes a CT scan or an MRI scan of the brain for unrelated reasons. Such an aneurysm is known as an incidental aneurysm. Your doctor may suggest a cerebral arteriogram if an aneurysm is suspected. An angiogram is a diagnostic study that is usually performed by a radiologist. It helps determine the cause of a subarachnoid hemorrhage or stroke and the treatment options. A very thin, flexible tube called a catheter is introduced into an artery, usually at the groin. The catheter is then steered through the blood vessels of the body to the arteries of the neck and brain. The angiography room uses X-rays to see the position of the catheter. A liquid containing iodine is injected through the catheter. This liquid is called contrast and can be seen on X-rays. Then the X-rays are taken. Angiography gives detailed pictures of the location, size, and shape of the aneurysm. It also shows a map of the artery from which it arises. With this information, you and your doctors will make a decision as to how that particular aneurysm should be treated. Other tests used to diagnose an aneurysm are CT scan, MRI, and lumbar puncture. Alternative treatments. Aneurysms can be treated using microsurgical open brain surgery or from inside the vessel using endovascular techniques. Endovascular means going through the blood vessels. Embolization is an endovascular procedure. During microsurgical open brain surgery, the skull is opened and a clip is placed around the neck of the aneurysm. If there is a clot in the aneurysm, the clip also prevents the clot from entering the artery and possibly causing a stroke. Endovascular techniques can be used to treat aneurysms without opening the skull. An endovascular procedure is performed in the angiography suite under general anesthesia. A very thin, flexible tube called a catheter is introduced into an artery, usually at the groin, through which coils or a glue-like material fills the aneurysm and blocks off its blood supply. This technique is called embolization. Materials used for aneurysm embolization include platinum coils. If the aneurysm has not already ruptured, then you may be in the hospital for a few days for either clipping of the aneurysm or the endovascular procedure. Patients with the endovascular procedure may be in for a shorter time. Sometimes the size, shape, or location of an aneurysm make its surgical clipping or endovascular embolization impossible. In these cases, your doctor may choose to block off the artery feeding the aneurysm. This can be performed by either surgical or endovascular methods. Surgical and embolization procedures do not repair areas of the brain already injured by a stroke. They are procedures to prevent the aneurysm from bleeding again and causing more damage. A patient who has had a severe stroke may continue to need intensive medical care even after the aneurysm has been treated. Procedure. In preparation for the embolization procedure, you will be asked to have nothing to eat or drink after midnight. During your evaluation with anesthesia, please ask if you may take your scheduled medications the morning of the procedure. On the morning of the procedure, you will be asked to undress and put on a gown. Next, a nurse anesthetist or an anesthesiologist will place an IV in your arm. You will be taken to the procedure room. The procedure room has 2 large X-ray cameras that rotate around the head. These cameras are used to produce special X-ray pictures of the brain that the doctors view on a screen. The X-ray pictures help the doctors to perform your procedure. You will be placed on a table that slides back and forth under and between the X-ray machines. The anesthesiologist will administer general anesthesia before placing a breathing tube in your throat. A catheter will also be placed in your bladder during this time to drain urine during the procedure. Similar to an angiogram, an incision will be made in your groin. A very thin, flexible tube, the catheter, will be steered through the arteries of your body all the way to the artery involved with the aneurysm. X-ray images are obtained when the dye is injected, giving detailed pictures of the location, size, and shape of the aneurysm, as well as a map of the arterial tree from which it arises. Through the catheter, the physician will introduce extremely small coils or balloons inside the aneurysm. This prevents any further blood flow into it. By preventing the blood flow in the aneurysm, the possibility of bleeding again decreases a lot. The placement of the coils is known as embolization. In some cases, a thin, flexible stent may be placed next to the aneurysm to hold the coils in position. The catheter is then taken out and you are allowed to wake up. The breathing tube will be removed and you will be taken to the intensive care unit, or ICU, where qualified nurses and doctors will closely monitor you. The procedure may last only a few hours, or it may last the greater part of a day. This is often not predictable, and family members should not be frightened simply because a case takes longer than expected. After the procedure is completed, the patient will need to remain still, lying flat on his or her back for up to 8 hours. This rest period allows the needle hole in the groin artery to heal. The patient usually remains under observation in the hospital for at least 1 more day before returning home. Longer stays are common depending on the patient's condition. Risks. This procedure is safe. There are, however, several possible risks and complications. These are very unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. X-rays are used during this procedure. The amount of radiation during this test is deemed safe. However, the same amount could be dangerous for a fetus. It is therefore very important to make sure you are not pregnant prior to an elective radiological test. A pregnancy test can be done when in doubt. Infection at the injection site is rare. The catheter placed in the artery can rarely injure the blood vessels of the body. The insertion can also cause injury to a nerve in the leg or arm, depending on where the initial injection was done. Some people have allergies to the iodine dye or numbing medicine used in the test. Make sure to tell your doctor about your allergies and about any possible reactions to any sort of dye used on you in the past. In some people, dye can cause kidney failure, especially if the patient is on glucophage, a diabetic medication. Other risks are more specific for this type of procedure. In some cases, the physician is unable to adequately embolize the aneurysm and further procedures may be needed, which may include open brain surgery. Rarely, the procedure can cause the aneurysm to bleed. This may require urgent open brain surgery. The risks of open brain surgery include strokes and possibly death. Even if the embolization is immediately successful, blood can flow again in the aneurysm over time. If an aneurysm happens again, it may require additional embolizations or surgeries. After the procedure, make sure to contact your doctor in case of any new symptoms, such as infection, fever, weakness, swelling, or bleeding at the injection site. You will need to follow up with your physicians for years to come. Other angiograms may be necessary to make sure that the blood is not flowing into the aneurysm again. Follow-up. You will be seen by the interventional neuroradiologist and neurosurgeon in approximately 6 weeks after your procedure, or sooner if you are having any trouble. Most patients will also need to return for a follow-up arteriogram, usually performed several months after the embolization procedure. This is to make sure that the aneurysm is completely embolized and has not grown larger. Occasionally, these follow-up studies show that a second or third embolization procedure is needed to completely cure the aneurysm. Plan on following up with your neurosurgeon to ensure the aneurysm has not continued to grow and to check the placement of the coils. Call your doctor if you feel you are having complications or developing new symptoms.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. An aneurysm is an abnormal bulging of an artery wall. Aneurysms in the brain can rupture and bleed. Bleeding aneurysms can be fatal if not treated. Endovascular techniques can be used to treat aneurysms without opening the skull. This procedure is performed in the angiography suite under general anesthesia using very tiny catheters, coils, or a glue-like material to fill the aneurysm and block off blood supply. The aneurysm embolization procedure does not repair areas of the brain already injured by a stroke. It is performed to prevent the aneurysm from causing injury to other areas in the future. It requires shorter hospital stay than skull surgery for clipping aneurysms. Aneurysm embolization is a safe procedure. However, like any procedure, it has risks. Knowing about them may help you detect signs of complications early in case they happen. Thank you for using Explain.